And the skin is not very dehydrated. The multi-puncture technique, combined with the Merciless product, is therefore perfectly suitable. Start the injections following vertical lines, from the base of the décolleté to the base of the neck. The movement should be fast and light, so as to minimize any residual marks at the end of the session. Pay particular attention to areas most likely to form creases, notably at the base of the breasts. Then inject a second series of lines, horizontal this time, in order to obtain a multi-puncture grid. Once the décolleté has been injected, start on the neck, injecting what are known as the salt cellars, that is to say, the hollows at the base of the neck. For the neck, proceed as for the décolleté, with very light multi-punctures very close together. You can either inject following vertical lines, or following the creases that form what is known as the collier de Venus. Injecting horizontally along the collier de Venus further stimulates the fibroblasts' secretion of collagen and hyaluronic acid. In this way, a filling effect on the fine lines that appear in the skin in this area is obtained. Finally, it is possible to combine these two methods and form a grid over the whole neck. For the patient's comfort, after having waited a few seconds to allow the Merciless product to penetrate, lightly massage the area. This encourages optimal penetration of the hyaluronic acid remaining on the skin's surface. Because the skin is not severely dehydrated, we will use the Merciless product combined with the micropapilla technique. To start the injection, point the bevel of the needle downwards, pull the skin taut with your other hand, and insert the needle's tip into the superficial layer of the dermis. At this point, inject without withdrawing the needle a very small amount of product, less than 0.001 milliliters. To increase precision, use your other hand to help you, using the thumb to stabilize the hand holding the syringe. As the product is injected, you can see the papule forming. The needle is then withdrawn in order to repeat the procedure. This action is repeated evenly over the whole area of the skin to be treated. After the first series of injections over the whole area to be treated, you can continue with a second series of injections, bringing the injection sites closer together on the most dehydrated areas. It is always preferable to inject a large number of small micropapules rather than fewer but larger ones. The reduced volume of product in smaller micropapules guarantees their resorption within 48 hours. Complete the treatment session with a firm massage of the papules. In this particular case of a dehydrated but young skin, we will opt for the Merciless product combined with the multi-puncture technique. Start the injections following the natural lines of the back of the hand with a very light movement. The injections should be very close together. Apply light but constant pressure with your thumb on the Merciless syringe plunger rod to inject a minimum amount of product at each point. When treating the hands, be careful not to inject the blood vessels or the veins showing through the skin. In order to effectively hydrate the areas to be revitalized, carry out the procedure several times on the back of the hands. Then inject the thumb area, and the fingers. Once the hand has been duly treated, wait a few minutes, allowing the product time to penetrate the skin, before lightly massaging the hand to distribute the product and encourage its absorption. It is possible to combine the two techniques during one treatment. First example. Most of the time, on the back of hands, you have an area where the skin is more dehydrated, the fingers or the space between the fingers. In such cases, you can also inject a few small micropapules in addition to using the multi-puncture technique. Second example. On a face treated with the multi-puncture technique, some micropapules can also be injected following the lines of the main wrinkles or creases in the cheeks and or around the eyes to give an illusion of fullness. In order to easily identify these creases, the patient should be asked to smile, which will show the lines to follow.